Internal and external marketing of your trauma program. Marketing is an important part of the trauma system. Let's start with internal marketing. Internal marketing is sharing information with others within your facility and educating them about what your trauma service is and does. Who really knows what you do? You as the trauma coordinator know what you do, the trauma medical director and registrar do, the ED, OR, ICU, and floor staff have an idea of what you do, and perhaps your direct supervisor has an idea. But everyone else has no clue what you do, and perhaps on any given day you wonder the same thing. Unless your trauma service is well established, even those who care for trauma patients may not understand its functions. Having a distinct service line for trauma patients will be a change for most facilities. The trauma service has a unique role in coordinating care of the trauma patient, but the service is involved in so much more than direct care: performance improvement, data collection and analysis, education, prevention programs, and efforts to achieve designation and verification. So who needs to know what you do? EMS services, ED physicians, ED, ICU, floor, radiology, lab, and OR staff, surgeons, physicians, department managers, department staff, everyone in the facility needs to know. Who is responsible to educate them? You are. Speak up and have a voice. So how do you go about it? Find opportunities to talk about your program. Staff meetings, making rounds on trauma patients, trauma committee meetings, other multidisciplinary committee meetings, hospital board meetings, mingling with staff while on duty. Food is also a good tool to use to get people to come to a meeting. Provide annual reports to department heads, administration, and the hospital board about the trauma program. Come up with an articulate response to the really big question, what do you do and what is a trauma program? Be able to talk about your service knowledgeably. How many patients a year do you see? Who are they? Has the patient population changed? What is the payer mix? What are the current care challenges? What processes are you currently working on? What resources do we have and what else is needed? What are your current program strengths? And you need to know who and what kinds of patients your facility provides care for. There are other ways to market your program internally. Writing articles, providing educational sessions, making sure your facility's marketing program is aware of the trauma service. You can participate in community outreach and civic activities, provide presentations to civic and service groups, always share your news with administration, the hospital board, and leadership, attend meetings within your facility and other programs, let people know who you are, get your face out there and put boots on the ground, and volunteer to work on other facility projects. What if people complain about the care or criticize the program? Always take the complaint seriously and look at it from their perspective. Keep an open mind and don't prejudge. Thoroughly research the situation and involve all of those who are affected. Educate people about what is happening and why. Let people know the outcome once a complaint has gone through the process. Make sure any process changes are thoroughly communicated to those who need to know. Always follow through. People need to know you're trying to solve their problems. Communication is key. Share successes and challenges. One of the best ways to highlight your program is to celebrate its successes. It's a feel-good moment for all. Strategies that were effective can be reinforced. You can showcase how all of your efforts have led to improvements in care and patient outcomes. Be sure to give credit to all, not just those who directly work with you. This is a powerful statement. This case would not have turned out this well 5 years ago. Network with other trauma coordinators too. There's no need to reinvent the wheel. External marketing. Take your program into your community, region, and state, participating in all levels of activity. Offer to provide a presentation at another facility in your region that is considering designation or struggling with their system. Invite others to come to your service and let them follow you around for a day. Let your community know about your facility's contribution to trauma care. Make sure your facility's public relations person is included in marketing the trauma program. Go to the schools and be involved with education, retirement homes, Kiwanis, Knights of Columbus, and injury prevention activities. Advertise in your community about what you do. You can use billboards, pamphlets, newspaper articles, and facility websites. Promotion is important. Send that positive message about your program in your facility and how your trauma program is changing lives in your community through prevention and outreach education. Teach your community how to be safe out there, but then let them know you stand ready to care for them in their time of need, even if a mass casualty incident occurs.